Yeah, on a kusha on a cabo once more. My name is John Fuller, and I'm the host for the Bɔdi Bεtεh Gentri program. We're a salon people that will learn book in medicine and other areas then within medical and social services. Now then they bring this program to now. We already bring this program to now. We don't know they get paid. We do them voluntarily. Today we talk about the sickle cell breakthrough. Basically, they look at the new advancements in sickle cell. And our Dr. MSI Kamara, Mohammed Kamara, and they present to us today, and we get the Bɔdi Bεtεh Gentri team. We're going to have the panel for answer any of our questions. Then, okay. Right, and like I say, today now 94th session, or maybe even 95th. Basically, we don't go on now for 6 years. The one that we don't join before know how long we don't go for. Last year we mark 5 years anniversary. We'll be get a dinner. Some people can be attend, and so we'll only go on for that period. Okay. And today is Sunday, the 2nd of August. I know say when I don't normally use to the last Sunday in the month for do the program. Unfortunately, we'll not be able to honor that because we didn't get a live program last month. We make things shift a little bit, but hopefully going forward we'll make sure we keep updates them as how we don't normally do one. And like I said before, we already do this program. We normally get paid now voluntary to do them, and we do programs then in Krio. We'll be on the promise we'll go for to do live some sessions in live, face to face. So we don't begin some last month, we'll go for do another one again, I think in September, then we'll go do another one maybe around November time this year. And by God power, if God continue for bless we, one day we go in our salon, we'll be able to get this program live to people and we need them. Okay. If anybody gets any avenue for this program reach you people in a tongue, whether by radio or TV, they are when I get in touch and we will try to do that. Okay. Like I say, the program they get recorded and it go there on Facebook and YouTube for people that we not able to attend, or maybe you want to use them as a reference point. So do you like I say before, as part of our data privacy rights, we therefore go to record this program, we're not able to take on our details them off. So they actually do ya if you know while your face gets shown or you know while your name gets shown, turn your camera off. Continue for listening, but turn your camera off. And also, if you know while your name show, change your name to something where you know say yes, you'll be able to accommodate. All right. If you ask question, most of them they see waiting the shows on the screen. If you see this one, for example, the first one, I don't know I will normally see. So if you ask question, that 3 dots they will there and now you go press. We press all this go show that you can use the chat and talk to me like I will talk to somebody on Facebook chat or what they call them or text or WhatsApp. Or for una way brave like me, una can raise una hand and you can press the button for raise your hand for let you ask question. However, if you not sabi do all of that, feel free for raise your hand up, physically, but you go for turn your camera on obviously. But also DR the big if you in an environment we're not good for public view, you are turn your camera off. All right. Now I don't talk boku. I can now to Dr. Kamara. If I get any suggestions, feedback, when I get me by email or send me a WhatsApp. Do not call that number direct because I don't go pick up. All right. Most of the time I keep busy and that number not connect to a phone, but it's there on WhatsApp. You send message on WhatsApp, go answer. And one last thing, the message will be given not to a personalized message. Not to say we not go help people them personally, but the reason we cannot give good personalized advice is because we not get to a medical record. So any information will be given general information. If the general information would give seems similar to what in the situation be, I promise you, not similar, no more than similar, but not to you directly, we refer to. Okay. Now I'll hand on over to Dr. Kamara. We're going to take on through the program today. Thank you very much, Dr. Kamara. Dr. Kamara, if you talk, you do on mute.
I'm Leonardo, and thank you. Good morning, good afternoon, and good evening, whatever you're in the world. Thank you for joining me, and we also want to go enjoy, learn a thing or two, and what we talk about today. Now, we don't talk about sickle cell, not to 1 term, not to 2 term. So, but I mean, developments don't take place. from 2023 to 2026, where we depend on now. Obviously, this sick they kill, this sick they cause problems and within the low income or developing countries or middle income countries. Of course, it cause problem for everywhere, but they get more than anybody else. And I make it fine for let me talk about this. So at least we're able for maybe get somebody with on them a bigger ledger with on them go for help we make we go forward. So this is not the situation. So we will talk today about how this sick begin with in history. We are the first person we find Usai we know Usai come out and I don't develop so far. How we did in the world, the different type them of this sickle cell, and the signs where you go take for no say this person gets sickle cell, and then of course the symptoms them where you go come with. So if doctor examine you, they look for signs, go say okay this person na sickle cell or not to sickle cell again, and then you get the one where definitely they tell you about the treatment we don't know from time immemorial, and then of course the new treatment as like I say between 2024 and 2026. Of course, to top that, what you go do now for see what you go for do in terms of how for prevent the sick, for lay spread more, for lay expand more. And of course, we go talk about the problem in way we they face within the low to middle income countries them, the poor one them, the one that we get money, the discrepancy, the difference between how they're able to afford for the treatment and management and the other way not get them that possibility there. So that this we talk about today. But you go nicely we talk about this man. Yeah? We all the area about this sickle cell and all that. But come on no say the first person we talk about this now in book we then call The Diseases of Tropical Climates and Their Treatment. Now we young brother when James Africanus Bill Horton. If you look at the right hand, you can see we need to be proud about this man. So 1874, now he find this thing out. He looked at the microscope, we've been the work. Like now the first black student in Edinburgh, Scotland. And when I go see this plaque now, yeah, in honor of him, the first man, first African, graduate of this university. So in a proud moment for we all. And of course, when you look at the books, then go tell you say 1910. Now in this man, James Herrick, Dr. Herrick, now they tell him find them out. But in actual fact, 36 years earlier, this man, with our young brother, been done discover him. So we're definitely proud, say yes. So again, they tell you why this thing important, because we find for let we know who that do this, who not do them, and then of course the honor need for go to the person. As they say, give Caesar in due. Whatever due Caesar must go to Caesar. As simple as that. We can't just allow people for hide this thing under the carpet and then take the pride, then take the if you like, the applaudits, then take the recognition there, whilst the person will do them, they get nothing. I think it's wrong, and I make it fine for low do them. So we don't talk about the years. 1874, now you do them, you discover them, and then 36 years later, 1910, now this other man input them. But of course, the UN, this big organization, then don't find out saying, this is here, Tranga, even the physics going to get better, but what's I? It's just to get stronger. So then look at this thing. If you imagine 1910 to 2008, almost not to 100 years almost before the UN decides saying this thing it gets priority for public health, because 19 way if you don't know about them, you can just continue, for do what you get for do, and then of course cause problems for the next generation. And then remember, the next generation will take 25 years to develop. If they say not do, I'm not sure it will continue endlessly. So 19th of June, and then decide say, World Sickle Cell Day. Just like how we get sepsis. Now the 13th of September, now in a World Sepsis Day. So we get all the way we need for definitely be mindful of. But this nasik way we need for be alert too. Because waiting do I don't see family then scatter. I don't see man and wife then scatter, bad one. Because when they find out, say the pikin will then get this sickle cell, and yet the mama say he not get them, the papa say he not get them, but then the pikin get them, then which side the pikin pull out? So a big problem. Then scatter, bad one, and we know say they cause problem. Because if you know about them, you go able for then work towards them, psych yourself towards that. Do what you get for do. The picking them at an early age, then go for monitor them, then go for treat them. But if you don't know, then it begin cause problems. Then a difficulty. So that's the thing. So now we need for define this sickle they talk about, this big sick. Waiting a sickle cell disease or sickle cell anemia, which some man can call out. The problem is sickle cell not to one sick no more than boku. We'll go talk about that as we go on. But this sick, as we know, or sometimes we don't know, the sick way they get because we use the same spoon, or sometimes we use the same towel, or sometimes I sneeze by you, I cough by you, or I talk to you, or I sing to you. No, this is not sick way they get from either mama or papa or from them too. Yeah, because we can do now the genes, now in the sick they pass. Yeah, we can make them call them sickle, now because of in shape, the blood, the red blood. If you watch an aya, that's what it's round like that. It's not the word for ourselves. That polo mint. No more, you don't get the hole in the middle. Yeah, but if you look the one way when they cut in the middle, you go see aya round. That's what it's. Whereas the one with a sickle, that's what it's. If you are like that thing, when they take for cut rest, people are already upline, then get a sickle. That sickle knife, where the man then call unwater. Where they take for cut rest. Yeah? But he now obviously gets a problem because we can do round. And we will then design the blood vessel and for let this round cell, this round blood cell, for let you go through them smooth. Like yeah. You see how way they go smooth. Here, because they go smooth now. Yeah. Here, because it turn like this sickle, it easy for let it stick together like glue, and it easy for let get destroyed. And when it get destroyed, that they make either it block the blood vessel, we go cause the blood not for flow, and then it go cause the crisis. Yeah? And then of course it go spoil or it go destroy earlier, quicker. The blood they destroy or get changed like how snake they change in Kanda once every 120 days. I don't know if you know about that. But because this round like that, it can actually definitely get problem because you only get for do it more often. So therefore, the changing of the blood will be more often than 4 times a year. And that is why you can get a problem with the production. That's another form of when a plastic anemia. Because the bone marrow inside the blood, they form, not able to catch up with the demand. And so therefore, there's a problem then. So this, it affects not only Africa, as they've been believed in the past, maybe 50, 60 years, or man in Africa, no more this day. No chance. Because nowadays, the intermarriages, the migration, people in the come up from Africa, go everywhere in the world. So this sick don't come up from just Africa, they don't go now to the Caribbean, they don't go to the Middle East, they don't go to the Mediterranean, they don't go to North America, they don't go to South America, wherever, even Saudi Arabia, did it. The Far East, Japan, you name it, he did it, definitely. First time, because we not been get away for 3 times or not been know what for do, people them they die young. The youngest person for die of sickle cell complications have been 3 days old baby. The oldest person will live with full-blown sickle cell, now 85-year-old mommy, when now one Nigerian Haja will live up to 85. He just died about 5 years ago. And obviously not to the sickle cell killer and all that thing. But it just goes to show now. So if we test early, we go save lives. Yeah? You can avoid all kind of confusion will go happen. So I just make I go through something the way people believe say, so sickle cell there. The believers will say already that now African people are normally get them. Well, not to say you, as I say, we don't go past that now. All over the world, you go get them. But the funny thing about it is that anytime malaria day, sickle cell not far away. Now 2 party them one day helping other in company. So you're like, I crash me back, you crash me on. And like that. I will talk about that as we go on. So this is just this slide just is telling us, say, if you watch, in the whole world, until we say now 8 billion we get, the population, this one get more than 20 million people them, we get them, the whole world. You go say that in a small, but I tell you, just imagine them born picking them. And then they say born picking them. This thing just spread more and more. So we need for no waiting for do, for try for stop them, because it could cause a lot of problems. Inside America alone, you get over 100,000. In England, the recent data shows it that 17,000 now they get people and we get them. Where they carry the trait. Not the one way the sickle, just the trait. And I should say them more than that because Bokumando been get no like to get themselves tested. They only go test themselves first on time the human taking, the human conceive, they get Bẹtẹh, then go check and find out. And when they check, then find out, then go notify you. So if the human not born or the human not reach the stage for born yet, then you not go know. So it could be more than that, but we don't know. But look at that, 300,000 picking them each year. Every year, now the world, now then they born with a hemoglobin disorder. As I say, if you watch, you go see all over North America, Latin America. Yeah, inside Africa, we get more than 5 million. That just tells you. That does not mean say you're not doing at the other partner. India, we're far from Africa. Look at more than 1 million. Yeah, it just goes to show you. Say a place not doing at the world, we this still not there now, because all man they travel. But look at this. If you look at the right hand side, you go see. Yeah, if somebody get normal gene, we not get sickle cell. Yeah, you go see say this person, if you catch malaria on 10 days, you go catch a bad one. Although you get mild, moderate, severe. Yeah? And the one way the one way you don't want at all, the one cerebral malaria, you want to avoid that. Because that one day in the kill will cause the brain for swell. But look at that. The person will get sickle cell, i.e. a carrier, he can get protection against malaria. You can tell us say this is something way I know about. I only find out say me not be get sickles, malaria, only when I find out, say, I get the gene when I hemoglobin C. And that is it. It just prove and say, yes, one way or the other, if you get the hemoglobin C, it will protect you from malaria. But malaria and a sickle, they kill almost every day, as it were. The one they will report. In fact, it's so bad, they kill so many people, that you find out, say, the vaccine they don't find, normally, for let them actually begin use vaccine for actually vaccinate people, you get to be more than 50% effective. Yeah, this one you when them find them less than 50%, but because of the number of people and way they die, then decide to let we try them because it better let we try with 20 than nothing at all. That now for the malaria. But imagine this when you get the sickle cell trait, the carrier, will protect you against that. And if you get this or two now when the full blown sick, you go see say yeah, survival trade-off between malaria and sickle cell. Let's see now how things they carry on, how will they work, So it's a good thing for let we know that malaria and sickle cell, then they rub each other one way or the other. One they protect the other, and the other one they look out for the other. So what to make we own place them, we own country them, we own place where we they low to middle income country them, then they get hit the hardest, which make now we they suffer past all man. Well, because as you know, we talk about more than 5 million we will get. Yeah. So obviously outside 5 million, they more than 1 million. For about 4 million more, clearly, definitely we will get more people and we will suffer. However, the important thing here is we can still get the 5 million, but if we get the funding where we require, where we need, we will definitely do better. But we don't get that. As you know, they don't cut even yourself, the International Development Fund, the IDF, they don't cut and down. They give America don't cut them, England don't cut them. So the thing they will be in the trade for help yourself, with them they send to we, nothing no they again. And it's just the worst in this thing. Besides that, we say no they help yourself. Somebody will get complication and the sickle cells until you get so foot, now you get so foot, we know the well, and so this one, now which they reach with them. Now cocoa, now in Bẹtẹh or something, or whatever, no insane that the circulation of the blood. Now you need to go fine, actually default, and because of that, if the person they smoke, even worse. Yeah, and if the person get varicose veins, even worse. So all of this, they say, oh, now the person, now which they which, or, now because, they pray much, now son of the demon or whatever, all kind of things. But in actual fact, they then just check out, then look the blood test, then check for that thing there, you could see, say, definitely, then go no. Again, because of the affordability problems where people don't get the money for go do them test there, for go to doctor or whatever, clearly, it delay the diagnosis. And even if then they even get the money, so then the technology not there in the country. So that can cause problems as well. So not to just the fact say not there. But if they don't get the money, well, how then go access them? So these are things what we need for think about. But there's good news, obviously, because we now get new treatment then. We now get advocacy like how they do so. With the sensitize people them. We definitely they make awareness high up there for make them people know. Say, no mean say because you get sickle cell, that means na death sentence. It means you die. No. We need for close the gap way 9 days between the one they will get money or the country they will get money, and we will just develop. Better myth we don't look at now this one. As I say, contagious. It's not contagious, definitely not. Because we can do me and you go in at the same bed, me you go in at the same house, we eat and drink together, but you don't go get them. If you don't get them through the genes. Definitely not. So if you not pay attention at all, this is not the slide where you need for pay attention, because now the slide this way get the talk. All right? So how this thing they pass from one person to the other, from one generation to the other. If you watch, you get 5 boxes them there. Go to the one at the left, the one at the right way there on top, the one way there at the left bottom, the one way there at the right bottom, and the one way there at the middle. If you watch, you can see the different color them. Some they in a pink, some they in a light pink, or maybe you can say this one red, and the light pink, and then gray. So if you watch this, you will see the papa na in the pink na ya. Yeah, in a carrier. The mama no get them, just like how we're talking under this now. No get them at all. The genes are all clear. When they come together, go give them picking, then get chances, 50% chance, not to just all the picking them all. I want this to be clear, because some man can make the misunderstanding say, now all the belly them. No, it's not every belly. You get 50% chance for let the picking them be carriers, and 50% chance for let the picking them be normal. It's not this. So 15 at the right, 15 at the left. Hope so then clear. Then you jump to the other one now, yeah? Say both the mama and the papa then get the trait where both of them are carriers them. Okay? Then when they get picking, each belly, and get 50% chance of the picking them for let them be carriers just like themselves. So the mama and papa carrier and get 50% chance of every belly for the picking for the carrier. And then they get 25% chance for let one the picking will be a full-blown sickler. And then 25% where the picking will be normal. Obviously, the pray say the picking that will come could be like this one now. Now when they not get trouble at all. As you see, 25% now affected. We know this gray. 50% are carriers. 25% you can get the full-blown sick. Now you come to the bottom left. Bottom left, this now where the papa in a full-blown sickler. But then the wife or the mama, him not get the sick at all. Okay? When then get picking, i.e. then get belly, you go see say all four, that is 100% possibility for let the picking them become carrier. Not full-blown, but carriers. What you do, the mommy, he not get them. The pa, he get them full-blown. So the likelihood of every pregnancy is that you can get 100% carriers. Now here, the right bottom one is where this one is normal. This one now in a carrier, then the man in a full-blown sickler. And then come together, then get 50% chance for every belly for be full-blown sickler, and the opposite side, 50% for let the picking them, not to normal, but carriers. So carrier and sickler, you go get from Udana full-blown and carrier. And then, finally, you come to this one, where no sign of the for turn. You turn right, sickler. Turn left, na sickler. When they come together, no chance, no day. As if saying another person born the picking, we are no one going to now. But if not them born the picking, then clearly all 400% possibility, say the picking, they all go be sicklers. Now, I hope it is clear. So, if the mama and papa na sickler them, the picking and get nowhere to turn but to become sicklers. If the mama na sickler or the papa na sickler, then the mama no get the sick, then 100% the picking and go be carriers. If the papa na person will get the sickler, i.e. full-blown sickler, then the mommy na carrier, then get 50% chance of full-blown carrier, yes, and full-blown disease 50% as well. So then shape. So I hope that is clear, but if needs be, and question and come, we can go forward to that and repeat them later on. So now, as I say, not to one grain sick no more. Some man they say sickle cell now one. No, they get different type them. They get thalassemia, so some man done your report. Then get the HBSC, then get the hemoglobin C, what I talk about, and then of course, then get the HBSS, when are the full-blown one. You see, but you can inherit one, then all they share the same HBS. I want for Leon to be clear about it. So the HBS, when are the sickle gene, now one. But then the second gene, we then go get from the mama and papa, now can change the type we then get. They all get the same S, but the second one now can change. Either it be SS or S beta thalassemia. That's it. So this night they show you what they talk about. You see, if now SS, then sickle cell anemia. The commonest one this way you see, and typically in the most severe form this. And then the S, see they all get S, as you see. S, S naya, and S naya. So now 5, they all get S. This one gets SS, and the worst one for them. SC, the combination of the S and the C, and then this one you're in milder. And then you get the S and the beta thalassemia, this one the thalassemia, instead of milder. And then you get the SD, SE, SO. This is not rare one them, but then get you then clinical profile. And then you get the S beta 0 thalassemia, instead of similar to the SS. So I hope this one clear, not to just one sickle cell day. Now, we get to the proper stuff. Usai, if you see from head to toe, look the picture on the right, from the crown at the head to the toe, all kinds of sickle you think about, all kinds of complications you think about, 9 sickle cell can give. It can give stroke very early. We can say picking get stroke where you expect older people well, you get to think about the possibility of sickle cell. You think about the eye. If you affect the eye, you can get retinopathy, which can cause blindness. Yeah, of course, because the blood they change so often, instead of 3-4 times a year, sometimes you go double that. The heart now get for pump more for let it maintain the body in demand. Therefore, the muscle will get bigger, and at some point it give up, say, unable. And because of that, they can get what they call heart failure from cardiomegaly. Yeah, the heart, the pump, now they work better again. If at all it affect the lungs, you get what they call infarcts, or then get the acute chest syndrome, where chest pain, and then it can cause pneumonia, chest infection, because the immunity not strong. Now, when you cannot the Bεtεh eye, because the blood they change so often, quicker than it should, you can get stones, gallstones we can form. Then they have no problem we can cause. You eat anything we get fat, palm fat, anything we fry can cause the gallstones to affect you. We get that agible Bεtεh pain. And then of course, I don't know if people know, this spleen within at the left, because the liver didn't at the right, spleen within at the left, in a day that the bedding ground for the blood for the blood. When the blood done in course, like that 120 days, and I can go better. Now, obviously, this can cause problems. The sickle cell can cause problems where the spleen they die for himself. Some people in there they can get accident, then they injure the spleen at the left, and now they go for pull the spleen because otherwise it could cause problem. Then people in there get for day on antibiotics for the rest of their life. Similarly to this one, if the spleen die for himself because of the effect of the sickle cell, well, that's it. You then get for look at something where go for help you throughout your life. The kidney cell can suffer with that. If you get kidney stones, or you get, in fact, where the thing die, the kidney cells die, well, obviously you can get blood in the urine. So if you see blood in the urine and you're a sickler, that's nothing you get to think about. Say there's a problem with the kidney. And you can see them so foot here. As I talked just now, some man go feel say, nah, I bet them better time, now which they reach with them and all that. No, and because the blood supply that they go through as it's supposed to, so it affect the skin. The lower the person they na the leg, like for example, yeah, the blood supply yeah, it better na yeah than yanda. So the lower the level, the worse the blood supply. And if you now get something we block the flow of the blood, then obviously the skin go begin suffer. When the skin suffer, you go bust by ulcer. This ulcer now and they cause this problem. It can affect the bone, we then call aseptic necrosis. So the bone they die, but not to infection cause them. Yeah, and then thereafter, because the immune system not good, then it can the bugs then can go inside the bone and then cause infection. Now this osteomyelitis where they hear about the infection of the bone, where nobody, even your enemy, no go pray for later. The bone doctor they will deal with them, and the worst thing this in there. They not like at all. They hate this thing because this thing, that chronic something, we can cause problem. So then some man can end up lost in leg. Yeah, you see the yayas I say, and of course we know say this thing can cause picking them for not for grow tall because we do it is stunt the growth. Yeah, and that's what we know. I know people in way obviously been suffer from that. So now when this they happen, if affect the finger. Now them called dactylitis, and so you can see them picking them. And so the hand they shine so it swell, it's shiny, but it's painful. The hand, the foot them, it can cause that, it can affect them picking them. Then you get the crisis, where all man sabi, we don't know what sickle cell definitely know about crisis. Now the crisis, of course, now this pain. Then get full type, we will not see. The one way the blood, because you know it turn like the sickle, it block the flow. So it block, like it turn glue, it stuck. And so you need to allow the blood for flow. And they cause crisis because the blood for go clean the places for clean, go give nutrition and come out. Because you need to go, they go suffer. Then the other one, obviously, now outside the blood, they destroy. They get destroyed. Hemolytic. Lysis, na destruction. When the blood get destroyed, that they give problem to the liver, at the same time give problem to the kidney. So the kidney now, the kidney, the spleen. The spleen, they swell, and they now, this blood cell, they go hide. Ready to go better, as I say, at the bedding ground. And that go make this spleen not work. And the spleen, we not say, it good for we immune system, for we army of the body. And then the plastic one, the one we talk about, where it affect the bone marrow, and so therefore, the blood cells then they form, and then long bone, if this one not get affected, clearly you not go do you not go produce, and so therefore you get what they call a plastic. Yeah, liver congestion, lung problems, heart problems, and of course fatigue. Because you're always anemic, you get tired easily. Your nails then they break. Yeah, the hair they fall off. Nothing that the mouth na we then say na fever or malaria. No, then call that kilosis. They call the thing lassie. I think then call them. We the thing man. All landing because of that. So I don't talk Boku, but this one let me take a breather. When I listen to this bubble,
I'm speechless. Like you guys have done so much for me, and it's like there's more. Like
the unique nature of this treatment is the patient is their own drug. So you start with their damaged cells, you then fix them, and then after conditioning the patient to receive them, you give them back.
I will speak for the entire transplant and hemoglobinopathy team when I say we feel blessed to be the first ones to be able to offer this to FDA-approved gene therapy to Sebastian and to the sickle cell population here in New York.
First, I want to start with thank all of you, because without you, I wouldn't be here. Growing up with sickle cell has kind of pretty much ran my overall life. I always had to deal with pain crises, the anxiety of whether or not I would have one, if I could do something, if I can't do something. And you guys have given me an opportunity to be normal for the rest of my life. You guys have really changed my life. Like, this has been extraordinary, something I never thought I would get to see. So, thank you, thank you, thank you, and thank you. Oh, and thank Mom, of course.
Thank you. So it just goes to show now. This is not the first bubble they get cured. Now I make I talk about it. So now we talk about the cure. I just show that for making I get a breather for my voice, but obviously important for Leona know say there is definitely a way forward. This slide very busy, yeah, but what they tell you now is simple. That they can do test them. You look at the left hand now, in the screen, with the woman before he and the man decide for get married and maybe get pikin or get Bεtεh, then go screen them, all right, and then go tell you. So when they take in, then go know waiting for do and then take the blood, then test them. If at all the answer come back as no, now yeah, when they take the mommy in blood, so the woman don't get pregnant now, then take the blood for screening for this hemoglobinopathy. That's what they call it. So sickle cell now one pandem. Yeah? If the answer come back as no, then obviously the mommy get the green light for go ahead and I make this green. But if now yes, then obviously we now get for provide information and get what we call genetic counseling for talk to you about the options that we get and what you for do. Then of course we go talk to the future papa, make himself come, then can check him. Because remember, if the mommy gets the trait and then the papa not get him, then the chances are less. But if in get him, mommy, the daddy get him, then clearly it makes it a bit more serious. All right? So when they check the papa to be and himself negative, then of course now low risk pregnancy. However, if at all now yes, the positive, then they will refer you to this the hematologist, who is the specialist on this blood thing. Yeah? And then of course they'll give you this genetic counseling, as I say, and then go for prenatal, it means before you're born, diagnosis. So they can go, when they can go that thing they call amniocentesis, when you go and take the fluid, that thing with inside the pikin, inside the mama and Bεtεh, then they self get risk of your own, they can do and check that, for check for see. When they get the results, if the baby not get no problem, well, thank God, nothing not there. Which is what you see on the other slide who talk say, if this one not get and a trait, then the other one, you not get then possibly you can get 50%, we not go get continue the pregnancy. However, if the pikin affected, then obviously you don't inherit this thing from mama or papa, and then get for get counseling. And then they go tell you now, what for do. You get for make an informed choice, they'll give the option. Either you carry on with the pregnancy, knowing full well with the problems with they ahead, or they offer you the option for terminate the pregnancy. Now this, so man go frown on this one. Problem is, they need for tell you that. Because if they not tell you that, then you can born picking way problematic, we get full-blown sickle cell. You're not going to be happy. So therefore, they go give you that. But there are times where they go tell you one thing and then waiting happen later on, a different thing. However, a chance where you could decide for take or not for take. But of course, you see now, when the baby born, they will take the appropriate, measures. They will do what they get for do, for try, for assess this pikin, for look after them. They can do the heel prick, so 9 foot, 9 heel, and then go do this test. And then it will take between 5 to 8 days. And then, of course, if you get them, you get the result early, and then they will begin now for make moves towards managing this pikin. So it's important for them to say, the message is the way they is that we can do this thing whilst the mommy in pregnancy early. And of course, the DNA analysis of the pikin in seldom can give you an answer as to whether the pikin get them or not get them. And of course, if the pikin get them, then the newborn can get the heel prick. We go able for make we get the diagnosis early, and then we begin to treat them early and monitor them early. Yeah, it is important for going forward that this will do. Right. This just to tell you specific group them. This is not the pikin them, we're not the young one them. Then get this thing we'll talk about earlier. Acute chest syndrome, as I say. If then short of breath, then get problems with them breathing, then get chest pain, and then develop a fever, like we go get, chest infection or pneumonia. Clearly, you have to think about that. Especially if the pikin, say, the Sickle or he carry the trait. So then you need antibiotics. Sometimes if the blood low, and then obviously they need for get transfusion. And then most importantly, they for treat the pain, because the pain na problem. And then of course, because they need for breathe better, and the oxygen need to get for flow to the body, the organ them, then definitely need oxygen. And then they go help them for fill the lungs and for help for let them get better. Anemia, we talk about already. Then they tire easily. Just need for run no more. And that you can see butu, they breathe, everyone, yeah? And then in growth will be delayed. And then, of course, nowadays picking them at the age of 10, 11, go don't pull Bobby as you are, don't get breast. Or they don't begin see them period. So obviously, that day in people that we get, picking the way get sickle cell, it can be delayed. It will come later. All of these, 19 the way they happen. So obviously, if they know that, then go know exactly what you for do. Yeah? If on top of the anemia, the picking infection, well, obviously, then go give them the antibiotics. The pain, this is a big, big problem. Because some man, they know say if they go na the A&E when at the day, when they come, then go tell them, say, once you go to the waiting room, this is not serious. Which is really criminal in my own view. Really sad. Because this thing definitely require immediate action. And we give them the painkiller, not to like them paracetamol namot. You know, you need morphine through the vein. Now I make you see, but of the people and we get this sickle cell crisis, then they then take their own cocodamol na os, then call the ambulance. Until go did 30 minutes, 1 hour, they be a normal. But they know say when the ambulance come for pick them, then go give them morphine na the vein, then go put fluids na the vein, then go give them oxygen. And when they take them, then they go take them carry and go na the place where the walking wounded they go. When at the waiting room, no. They will carry and go na the ambulance triage. Usai na they then go treat them quicker, then go give them antibiotics, then take them bloods and take them cultures, and do the x-ray, and then go be treated quicker. All of that because they wait na us, which is not supposed to be the case. But again, people that lack knowledge, you know, even doctors them lack knowledge. Yeah, and they talk about Africa now where the affordability not there, the availability not there, and of course the technical know-how not there. So all of that, they're part of that. So it's really bad. Yeah, you talk about the problems of the eyes. Again, if they get problems, we can cause them blindness. If you see somebody we get sickle cell, they need for be assessed regularly for the eye. We talk about stroke already. I don't see Pekin at the age of 7 get stroke. Day, then they live, they never for recover. And that now because they don't be noticing a sickle cell trait they get. Of course, the infection, because the immune system they work better or not strong enough, you definitely go be prone to infections. Therefore, the vaccines them, the flu vaccine, the meningitis vaccine, the pneumonia vaccine, and then they're important for make anybody will get that in the whether an adult or Pekin for let them get that in regular vaccine, then they go only help you. Hand-foot syndrome, again, the same thing. That dactylitis will be shown now. Where the hand they swell, the foot they swell, it's painful, now so they shine. Definitely, then go need painkillers, they need fluids if they get dehydrated. So these are all the things that way they expect to get. Then, of course, you get to the one that now we don't big a bit. Adolescents, we don't pass the 9, 12. Teenager them. Yeah? Then self can get this pain at the chest. Again, because the blood need to flow as if a flow, they block the blood vessel. And so therefore it need to flow. Again, chest syndrome, as I talk about, that itself no good. Yeah? So man we don't know about him, he say, he just a fake no more, or this or that. Then do ECG, the ECG fine, yeah? And then go give him paracetamol. Absolutely awful. They're not supposed to do that. The stroke can be silent. You know, they say this person gets to pass, you see sometimes in face drop, or he begins, begins, slurring speech. All landed. Definitely. By the time you go see him, you don't pass the 4 hour where if them in care and go, na the place in the neurology, they can go bust the clot for let the person in brain come back to normal. Yeah. The leg ulcers we don't talk about. If you not get the appropriate treatment, clearly then they go worsen. And if you worsen, it go up on the bone, well, it go cause problems. Because now you don't go to the bone, osteomyelitis, that you nobody don't want, especially the bone doctor them. The bone can die on itself. He then at the foot, he then at the wrist, but mostly at the hip because we can do the person they work all the time. Again, that's not right. And the shoulder itself, because they move, itself in a vulnerable place. So the hip, the shoulder, and the foot, definitely. The eye damage we know about already. But of course, if we get this early awareness, the education, the sensitization, and of course the treatment, yeah, we get rid of the stigma, get rid of the inequalities and the health access, then definitely we could do a lot better. Family support, absolutely vital. Yeah, it's not a one-man sick, neither the whole family. Yeah, the vaccines we need for take them. And of course, the patient then now get for be regularly checked. Then get for present for regular checkups. This is the other one. The myth. They say now short term. Well, we know say no to short term. Yeah. First of all, they think say now for life, but now we know say from 2023, 2024, we know say we get that we then call gene editing. Like how they talk about the video just now. Then go, then take the gene, we then was them, then do what they go for, then edit them, then bring them back to the body. Now in the app for able for cure the patient then. Superb, brilliant. 40, 50 years ago, they dream about that. People they die unnecessarily or avoidably, as they say by English. But now we get this. Obviously, it's expensive, but it's available. So this slide very important. If you look at the left hand, it says stop. Yeah, this is not the thing the way. If you know then sign here, then obviously you go for help the person. So you go for know what's not the thing they cause, the crisis. If you get an underlying infection, sometimes you get cough, sometimes you get sore foot, sometimes you get water infection, sometimes you get appendix or whatever, you go know. And that will make you think, say, no, go do this test too. No, can I go in the hospital? Yeah? If your oxygen low, now you're able to breathe better. You see they begin blue, clearly. If you're in too much stress as we know, it's good for level get stress now we life, now we community, now we society. However, past max stress, no good. And itself gets your own side effect. We can tell people and we get sickle cell, do ya? No, if you say because this place warm, you can just go expose yourself. Because if the weather change, believe you me, you're likely for let you get cold and you're likely for get a crisis. If you there, you know to drink as much, when the place warm, you can get dehydrated, and that self can be a trigger. Sometimes you don't get any clear trigger, we can cause this thing to happen. But if you don't know saying that this now can happen, then obviously. And if you don't get the knowledge of waiting you going to say this is not trigger, you then look and watch out for this acute chest syndrome, the problem with the belly, the pain in the belly, or the swelling of the belly, i.e. the right side when the liver, the left side when the spleen, all lengthened in it. Of course, the person, say get sickle cell or na carrier, but now you see say they talk fine. In face, they should say it don't droop, it don't go down. If you watch them, the eye and the mouth and the nose all don't go down. Yeah, see this na stroke, and you get problem for talk, you confused. Obviously, you go take and go hospital, then go do scan, then do a CT scan or MRI scan. Yeah, in the bone, if the thing die, the bone itself die. Well, of course, you go get pain at the hip, and when they go do the X-ray, then go see them. But this thing when priapism, or Kuma they talk about them, and sometimes they can happen. This now when the penis, the thing we call man, when it team up, they go down at all. Don't say the person want to do any kind of business or involved in sex or no. You just team up on them because we can do this thing don't go, it don't block the blood vessel. You just team up. It's very painful and it can cause a lot of problems. So if you know, say this person get them and this person get because sometimes you can get them because you get problem with your neck. Yeah? But if you know say this person don't get problem with the neck, but then this thing team up before them and they cry in pain because nothing to do with the gam. Painkiller, the gam, or gam, they walk, you need for begin think about taking this person definitely to hospital where then go do what's necessary for make this thing can done. It's really painful and it can cause problems because it can cause the tip for die of the penis for die and that's no good. So you learn, say if this person in oxygen low, you give him oxygen, definitely 15 liters. It's good. This now for we, and then of course, again, give him prompt analgesia. Not to just the kalukalu one. You need the strong one. Yeah, and then not only give him, but assess how effective this thing is, whether it don't work or not, because that's that they need to do. And they give him paracetamol, sometimes 2 hours later, then go check. No, even if you give him morphine, you need for check whether this morphine is effective or not. Sometimes if you give him 2 milligrams, you take care of the pain, but then 30 minutes later, the pain come back, you need for top him up. But you can only find out if you go check by the person. Of course, you need fluids, because the fluids now go pull poison, now go rehydrate the person, and of course, now go wash the kidneys and make sure say everything they work nicely. And of course, if the blood very low to the point the heart now no for function because they work too hard and now instead they begin fail, we then call heart failure, then you definitely go need for transfusion. So if the hemoglobin less than 70, where the person not symptomatic, you not get symptom, then yeah, for transfusion. But if it is at 80, then the person is symptomatic, you get the symptoms, then you can transfuse them. So here we are. This is not just the treatment as we talk about. Then vaccine we'll talk about, folic acid. Then the way no get sickle cell, then go tell you. That they definitely good because it support the blood in turnover. Instead of it happen every 80 days or 60 days, it will probably be closer to the 120 when at the standard time frame that one day. And because the blood transfusion, we don't talk about. Now, which we know about is stem cell transplant. Then go pull the stem cell within the marrow, within either the pelvis or the long bone them, then go then do what they go for do time and modify them, and then of course then transplant them to the person, especially if the person na matched donor. Because not all man go fit, but the one way then test them, he match them, he actually help them, then he obviously could benefit from that. Painkillers we talk about already, not to just paracetamol. Definitely you need the stronger one. Ketorolac, we then say anti-inflammatories, and of course morphine, and then antibiotics. Obviously, we can't not talk about those. Yeah, so we get the left hand now. The one the way them they use the drugs of them they use. We still current. The one at the right hand, they know they use them again. Now we're not going for nobody, but we're not for no say them get for take them off the shelf because of problems. They may be more of a risk than the benefits. On the left hand now, you see, and still they go on. Somebody mentioned hydroxyurea. He did it, and they use and still a long-term use down there. Increase this, especially baby them, the fetal hemoglobin, and remains the mainstay. And the main thing that when they use. However, then get the erythropoietin, we insert can help, and certain patients they not all man. This now they have for increase the blood, for make the blood turnover better. And then hematopoietin. Hence I see them say poietin, that thing way they produce, that thing way they develop. So hemato, the blood in general, and erythro, na the red cell on the own. As you know, the blood not just red, they get white as well. So the hematopoietic cells, this is not the one that way then they pull from the bone marrow, and the baby them, and then transplant them into the person. And only long established curative option for lead, and say this one long standing, long lasting, no more. So through the donor, and of course we get for think about the matching. If the person not to match for your own stem cell, well, you not go work. You see, so you get in your own shortcomings. You get for be a match for the person for receiver. Gene therapy, as we see now, obviously, it's genuinely possible for cure. Again, you can forget eligibility. You can for be able for say this person, he fit this one or he match this one. Other than that, likely. So not for all man, for a selected few, now make them they do them. So stay informed, get empowered, and of course, manage the sick and improve the life there. So as you can see, now this video where we play earlier, the bobo where we see at this 9 dengiam, this middle one, Life Junior. This idea, I don't know how the government then going for Epway. It's so expensive. At 3.3 million for one patient. Now, in America, then do this bobo, as you see, he don't survive, he don't get cured. But this will find the video where they tell people and thank you, where they say, for there. But if you watch, not for all man, but for only the one that way age 12 and above. So if you're under 12, this one at the left, probably 9 likely for you. So picking them, and this Cas-GV, we then call XSL CRISPR, in the gene editing cure dande. Ion, and don't approve them from 2023. Yeah, same as this one. But this now for the 12, and then now for the 2-year-olds. Yeah, so how do they work? If they edit, so if they take the person in your own stem cell, you switch them to a different one where you go turn them to the picking hemoglobin. So it prevent the sickling, i.e. that glue where they form with then sickle cell than they. It prevent that from happening, and so therefore the person definitely will live better, less crisis, less frequency, and of course live a better life. But only for 2-year-olds. For the 12-year-olds, we get Life Junior, and of course then get them benefits. So in they reduce and they take away this thing way now in they block the blood for flow. as I say, that clot they formed from the sickle cell. Now this one, in good, is still not completely resolved, make them completely yet. Which make this one better pass the wire. The wire all, then through the green and the blue, the invasive means they go for go inside the body, go, if possible, you get infection, it can cause other thing them. But this one, in a tablet. However, they're not complete yet. Yeah? Then still they look at submission this year. So hopefully something them go for get that approved, then that will be good. Now you name that now etavo pivot. Now you name that. Which making good, you can take a tablet. Just like how when people they get blood clot and they give injection for prevent the blood clot. Now they don't find out say then they give tablet for prevent that. So then they give warfarin, now then they give enoxaparin with the person go na host. So the tablet people in Lekam and they better and they're more compliant. Similar to this one. If they give injection, clearly not all man like injection. This one, if you forget and go through, that could be really good. Because what you do in a tablet, people only take tablet. So, prognosis, this is good. Now, not to that doom and gloom, where they say, if you get sickle cell, now that not die. No, the life expectancy, like I say, it don't improve tremendously. Yeah, because we can do, as I say, 85-year-old Haja, na the longest living, and then the 3-year-old baby, where obviously complications, unfortunately. Yeah, early diagnosis plus consistent treatment will give you better outcomes. It will make you live longer. It will make you get free of crisis, and it will get for spend less in the hospital, less time now host, and of course able for get more in terms of income and all that. The gene editing, we know about the editing of the genes and the therapies where they include definitely could give you some cures, but not to everybody. So sickle cell not to like how we think and tried it 50 years, 60 years ago. No. Nowadays there are things you could do, but obviously you get for sit down with the team, including the GP them, the doctor them, and of course the hematologist that we get for do that. Plus, of course, the genetic specialist them. They all come together, and I'm sure they will improve things. So remember, how to prevent this thing? It starts before the symptoms them. So before you say, this thing don't pass Marco, well, you need for don't stop them. So if you do the testing, you do the screening before the Bẹ̀tẹ̀h happen, before the pregnancy happen, then obviously you go know your status, and then you go know what you for do. So you plan for a healthier future. Yeah? And if you unfortunately Bẹ̀tẹ̀h come, or maybe you don't get to the point now you can't, scatter with this person because you still love each other, then obviously other things they for do. You get what you call genetic counseling, what we talk about. They'll take you through that, then check the PA, instead of way for B, instead of then find out whether the chances are higher now or lower. And then like I talk on the slide. Then of course, you then go for make an informed choice. You know what in they happen and you know what for do. If at all you're able to carry the pregnancy through to term, you born, as the baby born, then go begin screen them, then we begin actually treat them if at all you get them. And of course, this is important for make the community aware, make the community be educated, for let them know what for do and get things moving. Because waiting do prevention, they empower the family them, and then early action, they save lives, as we know. No questions about that. This not just for telling, I say some food then day we go eat, we go help you if you get sickle cell trait or carrier. As you can see, all the beautiful foods we can see, you get, fruits, vegetables, fish, cheese, nuts, milk, water, all of that. So drink plenty of fluids, enjoy, nutrient-rich diet or foods, omega-3 fatty acids, and then, of course, calcium-rich food them, yogurt, cheese, and all that. And then make good nutrition a family affair. Let not be saying that the sick man no more, or that the person will get the trait. Let be saying that we are all the family involved. In that way, we could be stronger as a community, the growth could be better, and the development definitely could be better, and we get more energy and daily well-being. You feel well, you feel good, and you could definitely get your mood better, and then, of course, the income could be better. And, of course, as I say, a healthy nation, a wealthy nation. Okay? This now at the end, but now, I just need for telling you 2 cases them. Sad. This woman, Iman, been the big for let them see him. Yeah, nobody no listen to them. In the end, the sickle cell crisis 9 kill them. So when they do the postmortem, then find out, see, definitely this woman, the complications of sickle cell 9 actually kill them. Therefore, then talk and say, if at all, then be intervene in time, this die not for happen. But as you see no more, the coroner not decide, say, if I actually give which they call regulation 28, when a prevention of future death. So any way somebody die, when they find out, say, there's something for learn from that, for letting not happen again, the coroner get the right for send the message to the Department of Health, Ministry of Health, for let them circulate them to all the hospital them, so that this thing not go happen again. But of course, you know, do them at this time. Now, I'm not going to say because now black woman, but it's really sad. Now, you don't talk and say, if at all, then we prevent this thing by intervening early, this never happen. But yet you still not do it. You know? So it just goes to show you, say, we get a long way for go. Forget equity in, you know, health. This and kill me. This Bobo, 17-year-old, Mamadou, Ba, 17-year-old, he did the seat exam. I think they say he using phone for seat exam. What did they do? This is about 2 weeks ago this thing happened. Now Guinea, Kindia, about 130-something miles from Conakry. Look what happened. They arrest the Bobo. They say he cheats by exam with his phone. Then put him in jail. Imagine that. 2 days. Next thing I realized, the Bobo go into crisis. Now that. By the time they take and go to hospital, the Bobo die. Avoidable death. See how sad it is. How you go put this Bobo in jail because he used mobile phone? I don't know if it's a crime for use mobile phone, but even so, the Bobo go to cry in pain. But as you see, the awareness not there, the knowledge not there. So therefore, this Bobo die avoidably, you know, unnecessarily. This is just, as I say, instead of now that busy slide, but look what you for take away from this. If you don't know about sickle cell, but look at this. 1 out of 500 African American births do have sickle cell. 1 out of 500. Yeah? For the Hispanics, them, the Latin American, them, then are 1 out of 36,000. Yeah? And of course, for we, the African Americans, 1 out of 12. Just imagine that. So we definitely did more at risk. No questions about that. Okay. Finally, well, we as Dr. Dem, all the time people in a complain, they complain. So among me, they don't complain because I always smile. You can't imagine that. Me, they smile to person. But then tell me, say, I will whip the smile off my face. I can't believe that. Okay, but that's what you get. So when you get compliment, where somebody tell you thank you they gladly like say you native man well fast, they can say, yeah, you're grateful, you appreciate the warm words, and of course the recognition and the compliments. For me, it's very humbling and it's very motivating for me. Because when they can go and bug me, so saying small picking can fit me, they can talk all kind of nonsense because of this or that. Now this thing that I can look at, now it can then build me up, can lift my spirit. So I don't know if I will read them, but they're on the right, waiting the person right, and anything I can read. I'm so pleased, I'm so grateful to the person who write down that, for the rest of my life, I remember this. But this is what we get. Okay? Thank you for every late check-in. Remember that. Every word of reassurance and every effort you make to see me not just as a patient, but as a person. You are truly appreciated today and always. I thank you all and happy to take questions.
Thank you very much, Dr. Kamara. Wow. I hope you get what out. There you go. The boss. I don't tell you, say, one of big and be like you. See me on cup, now standard, you don't get boss. Let's see, but if they type anything from you. Anyways, thank you so much. For Fambulem, Dr. Kamara don't do a fabulous job, and by the clap and thumbs up and love hearts and stuff like that, we play the show. Thank you so much. We appreciate you all for joining. Now, your own turn. Yes, now, your own turn for let us ask questions. For the one we join late, we're not able to take personal and give, we're not able to take give personal advice. But to say we're not going to give because we not get a background of medical records. So for that reason, if you ask questions, if it's something personal to you, we will try for give from a generalistic standpoint. The advice always that for let you see your personal physician, when I get you record, I know they treat you, now you understand. Now I'm able to give you that personalized advice. Okay. Yeah, Margaret, I don't see you. And I'll come first to Auntie Nafi, I hand up first, and I will read the comments them where Auntie Nafi done. Auntie Nafi, you can unmute yourself.
Yeah, thank you so much. Thank you to Dr. Kamara for this great presentation. A great refresher for me. But I just not a question again, I just a comment, but just for add to what Dr. Kamara say, prompt treatment is very important. When somebody there in crisis, you identify the issue quickly, you give prompt treatment. I remember when we were working at hospital because some of them were there, they're very busy, medical ward. You're so busy with patient then that when the patient with sickle cell in reach for getting medication, sometimes then you can miss that 2-hourly medication day or whether not 4-hourly, then put them 2-hourly or hourly. You know, the nurse can intend for miss, not intentionally now because of the ward so busy. By the time they come back to that patient, they 1 hour don't pass, 2 hours don't pass. So they're not going to get a medication on time. But sometimes there's so other health professionals they can still perceive and say the patient, oh, they don't become addicted to the medication. How this pain not they can try for like I say and say the pain not as severe as the patient they show and say be. But always here they talk, Dr. Kamara, point where make say if you give the patient the medication on time and how you need them, and then they play because the pain is really, really bad. You know, somebody will get sickle cell, we see inside the crisis, you say go sorry for them. So this is not just for raise awareness or just help out in though, because me don't work with sickle cell patient and they tell them why they work now hospital. I know say will be the first time problem, yeah. You know, if they didn't get a medication on time, it's really too much for them. So I mean, just want to add to that, not a question. Thank you.
Okay. Thank you very much, Auntie Nafi. Thank you for that contribution. Margaret, I will come to you now.
Yeah, good evening, Doc. Thank you for the education. I get a question where they bother me. I'm not so sure, but since the medical expertise and they are just saying at the platform for that ask. I see a video on one of the social media awareness group where there's talk say if you give oxygen before the crisis they reach a peak level, they prevent the crisis from happening. I want to know how true is that according to research. That's one. And two, regarding this hydroxyurea, where some of we not be the no what some of we not really know, but me I be done here but I was skeptical because they say they give fertility issues and then it getting other complications because now cancer treatment drug. And so the first time I begin take I was admitted earlier this year. I be in a hospital. I be severely sick and jaundice. And when they give me, I be the bloat me, belly be the bloat and I be the throw up. So I discharge, I stop for take But after a couple of months, I don't go back for go take And I notice say this cause discoloration, na me hand and toe nails them. They make it black. That's now one thing I notice. And then another thing where I hear they say it add to fertility issues. So like if you're a woman, you need for freeze the egg, blah blah story. I don't even know the dosage back where they can put people there on. And then well, I don't know. I'm single. I don't know when I get for married and decide for born, but I'm already in my early 30s. So I want to know waiting at the other intervention there and how true is the oxygen delivery if it will help prevent a crisis. And now portable oxygen where people they get overseen not there. So yeah, pass you go to hospital and it's not cheap. It's quite expensive. Me anytime I get crisis, I spend millions. And I can really feel them because not all man they for afford and not all man get the resource. Now I lost both people that will get sickle cell where I can just we say they don't sick, they die. Like I not even know say they be sick. And it's the challenges them boku, but because I did a lot of support group and are active on social media, I get to reach out and meet so many of them where I able and help in the little way that I can. But these are my concerns.
Thank you very much, Margaret. Over to you, Doc.
Right, okay. Ms. Cassell, thank you so much for joining me. We're grateful for your support and we wish you well. Now, you ask a specific question. Can oxygen prevent a sickle cell crisis? The simple answer is no. Yeah? I repeat, no. So routinely, if you give supplemental oxygen, it's not able to prevent or stop an established sickle cell pain crisis. If any medical person get for use them, not because the person get either an acute chest syndrome, we talk about already, or then get pneumonia, which means the oxygen saturation, when they put that in the finger, or they put it in the ears, is less than maybe 95. Okay, so in that case, they can use them for optimize the oxygen, for give the person more oxygen at the lung, so that the lung will work better. Yeah, I hope so. Then they clear. So in need to prevent them, but as I say, it can help for somebody who gets chest problem with the crisis. Yeah, the second one, hydroxyurea, where you mentioned, as I said, that the mainstay, but then get common side effects and serious side effects. Now, of course, the side effects of hydroxyurea, we know now the low blood cell count. So the army, the defense of the body can be less because of the hydroxyurea. So because of that, and the platelets, when are in the air for the clotting, it can actually make the person more prone to infection and then bleeding, and then with that, even worsen the anemia where the person get already. So blood cell count lower with hydroxyurea. But that is something where they can deal with, where they can actually help you with, because they can transfuse. If the platelets you need, they can transfuse them. And then they go increase them, then they go lessen the bleeding. Okay. You can get problems with the digestive tract, inside the food pipe there. It can cause nausea, vomiting, diarrhea. And the opposite, it can cause constipation. And then, of course, it can cause loss of appetite. The appetite can be less. Then, of course, it can affect the skin. You can then, as I talk about malaria, then saw them at the mouth. And then it can cause the skin to be dry, and then the hair itself go thin. And then it can cause rash in the body. Then gets the one that win a long-term effect. When one the way the cinema very rare, we see them. Then of course, then they win the skin ulcer them and the discoloration of the nail. So the nail can get discolored. The lung and the other organs them can get affected. Therefore, the person can get problems for breathe, shortness of breath, and then inflammation of the lung. And then of course, then say hydroxyurea can cause some other cancers, such as leukemia, but that rare. Very, very rare. It's hard for you get them. But as I say, in medicine, because now inexact science, you know go say, if this person not don't report them, that means you know they. That's how we work. One person get them, we begin look at how this thing don't extend to other people and we will not know. And with that, we then begin to learn how things are. But so far, as I say, cancer are the least of the worries, which you need now to take you go forward for make you get less crisis. So if hydroxyurea is what you need, then go check out and monitor for the other complications then. Yeah, and then treat them as they find them necessary. I hope so that answer your question, Margaret.
Margaret, did I not answer your question? Just put a chat or raise your hand, then I go add you again for let you talk. But if I'm not hearing from me, then I'll take and say you're happy with that answer. Okay, so I'll get 3 people. I'll go to Grace first. After Grace, KDC, then Auntie Amide Thomas. Grace?
Yeah, good evening, everybody, and good evening also, Dr. Kamara. Thank you so much for such an informative session. I just want to ask if somebody get alpha thalassemia traits, if it also protects you from getting malaria, and if say you they travel to a place with malaria predominant, if it's necessary for take prophylaxis, if you get the traits of thalassemia.
Okay, I think I can tell you about myself. Me not to thalassemia me get, and I don't know if there's anything specific to just thalassemia as itself. One thing I know is that if you just get the trait and you want to say because you get some protective mechanism because of the trait against malaria, then evidently you probably put yourself at risk. Within the sickle cell, if you like, gene or whatever, they actually help you with, is probably less likelihood. So my only suggestion to you is that if you go in an endemic zone, then perhaps take them. It's important because that way you can prevent any kind of possibility to happen rather than depend on your own natural, if you like, defense. I don't know if that makes sense. Yeah? And that is it. Yeah, Miss Ensa. But that's it. So, means you got to depend on that because the trait you get, that means you protected. No. I would have said, in nice for you take your own preventative measures by taking the medication we need for prevent you. Because one thing you don't want, that a bad one, the falciparum malaria. And the bad one, the cerebral one, and that definitely can cause problems in a short while. So therefore, take prevention, and that way you're smooth. All right, thank you.
Uncle Doc,
Yes.
still want to know about taking hydroxyurea, if you go affect infertility.
I know, as I said, from what we know from the BNF, maybe, let me tell you the word. You get what we know and what we don't know. From what we know, there's nothing about fertility where they mention. Now, maybe somebody don't come forward because you get within a common side effects. Yeah? You get not very common side effects. You get rare side effects. So, the rare ones, them obviously, malignancy, the leukemia we didn't talk about. But other than that, the nails, the alteration of the color, and of course the hair, and the other things then with that thing within the mouth, the chelosis. Of course, immune system will be weaker, and so obviously it can be prone to infections. But in terms of fertility per se, there's nothing there where I don't see. We don't point out say fertility could be affected because of sickle cell. But I can't tell you, say, that's not exact because until one person not come up with that. But there's nothing there listed amongst the common ones.
Okay, and Yami there as well, Deon.
It's up there, so take go up with that.
Another thing we ask about, I don't know if this now something way general or down to the individual, but they ask about the recommended dose.
Well, that depends on who that's the game, as it were. Me, not to hematologist, but I can look for the dose. There's no problem. Whether not the same way then they prescribe them Nasalone or not, I don't know. But surely, if then they do them on a regular basis, then supposed for know the dose. I don't want for can't tell you saying that this dose that they give you, then in actual fact, they go give you a different one. Now, a cause for collision, and that's unprofessional. They're supposed to do them accordingly. There's no two ways about it. Yeah? If you're not happy about that, then you can seek advice from another clinician where you feel, say, you get hope and trust and faith in. But I can't tell you exactly how we prescribe. Because we do we own, but whether in the same regime than they do them in Africa, I can't tell you. And you're not go nice for make I give you one word, and then you go put them to the other clinician, and you're not go nice. Yeah? But we can talk. Check them offline. We can talk personally one-to-one. Yeah?
Okay. Thank you very much, Uncle Doc. KDC?
Yep. Yeah, hello.
Yeah,
Hi.
how are you? Welcome.
Yeah, thank you. Thank you so much for this wonderful presentation with Dr. Kamara. Mina Kadiatu Conte and us living in Sweden, classmates to Nafisa to Sumare.
Right.
We are a family. We don't live with a sickle cell daughter all we life since the 8-month-old. So we all waiting Dr. Kamara talk soon as something we don't live, we don't experience, especially living in the part of Sweden where the Black community not plenty. And so I can remember most of the time they call ambulance for picking for go. Then they ask me, but anemia no more it gets. Why would they call ambulance? But this is not ordinary anemia. this is sickle cell anemia. Some of them don't even know what sickle cell anemia is. So we have the term used for educate them, tell them, say, this is sickle cell anemia. Now the red blood cells, they affect. This not to ordinary anemia. So then they think, oh, okay, now waste of time. Why they call ambulance for anemia? But anyway, my question where I get for Dr. Kamara now, I want to know who say the bone marrow transplant treatment fall in these three category of treatments the way it presents, because I see the blue, green, and red or so. There was three different category of treatment. I want to know why bone marrow transplant fall. And then I want to know if there's a difference between a bone marrow transplant and this gene type, the other gene treatment.
Well, the bone marrow is quite different from this life genia, if you see. Yeah? The bone marrow that we don't know about for a long time now. Again, invasive, as I say. Obviously, they important for, like, say, the bone marrow, again, just like how they do with the Casgevy and the life genia, then they take them away from somebody, then they make sure say match, then of course, or then take them from the person himself, they edit them and then they transplant them. That's not the new thing we don't do nowadays. But the bone marrow itself, obviously, then they transplant them for the person able to produce what's necessary for them to make it go ahead. The problem though is if you don't edit them, clearly the same thing will just produce. So the transplant itself has to be something where then go down edit. Yeah, they alter them and then put them back into the body for let the person able for developing your own. We go prevent the sickling. You see, the difference between them is that this one, the age specific. This Casgevy in the 2-year-old. This junior in the 12-year-olds and above. This one now still in the pipeline. Then get other ones within the, obviously they still experiment or maybe they develop. But I just want for let people and focus on Gentri away and the one that way don't show promise as it were. But the bone marrow obviously don't do for a long time. However, it gets your own side effects. I think I remember somebody telling me that they do the stem cell or bone marrow transplant and then the person end up with so many complications, including, later on develop diabetes, infection upon infection and things and all that. And as it is, the Pekin always stay in hospital and the rest of it. So it just goes to show you. But this now, this Life Junior, obviously, is, as I say, light at the end of the tunnel, if you like.
We are exactly that particular family there. I've seen myself inside that picture. We recently, for 3 years ago, don't do bone marrow transplant for Pekin, for cure the sickles. But the complications, the after complications are so much. So much from one thing to the other. Up till now, we did that struggle there with that.
Then it is sad.
I asked for, I know about a meet Sierra Leone who've been there before, where then they say, oh, okay, if you get sickle, say as soon as you cross 21, if you know that, they die again. I just wonder the crops the way then they in Sierra Leone, if they go around with that meat there, because I remember where they diagnosed we Pekin for sickle cell, the first thing where we ask like that question, because now we don't ever know about. Now the doctor tell me say, oh no, So I just want to know if people get that idea they still over there even when they inside 2026, because now they think that they lead to so much complications and these forcing kill Bεtεh say they wait for late 21 so that after 21 no go die again. Sickle cell no go kill them again.
I don't know side that what they come out, or side that feeling they come out. I'll be honest with you. Me no say people when they die very early, very young. Now if they say after 21 they die again, well, that is a fallacy. That's not true. Because everybody no make any sense for believing that. I know for sure that with the right approach, the right surveillance, the right methods of investigation, support, and of course treatment and management, people need to live longer. As I say, people are not expecting this man will live to 85. Yeah? And when he finally pass away, not to the sickle cell complications. The other thing, I don't know if somebody will die as early as 3 days. But it won't be so profound, and obviously you may get other issues inside the belly, inside the womb, as it were.
Yeah.
So I don't think there's a clear-cut rule for say if you don't die before 21, you don't go die again. That's definitely not true.
Yeah. Thank you so much. Thank you for the answers and thank you for the presentation.
Thank you. My pleasure.
Yeah, definitely. Latina, the way most of you be there, told me not on. I don't feel of me because then we as a result and just look and say, well, that in a way that be a myth where people just accept. Now, what was the proof behind it? I don't know. Yeah, Auntie Yami there?
Mr. Thomas, you mute.
Yeah, I don't ask him for a mute. Yeah.
I don't mute.
Yes, ma'am.
Yeah, very quickly, God, I multitask, so I know go on camera.
Okay.
Let me go back to with hydroxyurea, the fertility issues we know about or we can hear about is the fact that it can lower the sperm count in the men. So then can either get for, it's not the word, preserve then sperm or go off hydroxyurea till then sperm count, if they want to get, if they want a child, yeah?
Yeah,
so it lowers the sperm count. And for the men, I'm not sure about how it affects women, to be honest. So we'll go for check that. But for men, definitely, think you say it lowers their sperm, it can lower their sperm count. So we'll go for check the question where Margaret asked. Although I think they can advise women not to get pregnant when they're on hydroxyurea.
Indeed.
But I'm not so sure. Yeah. The thing that we maybe want to say is just thanks, MK. I think you covered. I mean, I was here throughout, but as I said, I did multitask, but been listening throughout. Some of the things that I kind of managed to jot out because I work directly with the NHS screening program in the UK. That's an antenatal, i.e., you're already pregnant, and newborn screening. So if the woman gets the trait, then they call the papa for CAM, and if then two get the trait, then they meet all then counselors where you mentioned. So the encouraging thing is try for get the men for CAM because some of the times they don't. I mean, we don't do a lot.
Yeah.
By the way, for people that don't know me, I work with the Sickle Cell Society. Sorry, I forget to say that. The UK charity for sickle cell. Yeah. And I will put some things in the chat so I get, the website and some resources because we do when I say recent, a few months ago, a very good podcast. We cover a lot on the screening. Now, before pregnancy, preconception testing, we do a really new leaflet because officially in NOTO, it's not part of the NHS screening program. The NHS screening program is an antenatal and newborn. But if you go to the centers, they have NHS centers scattered around the country. They will test you before pregnancy if, they usually do that if you didn't have the area, right? Now, at the society, we get a lot of complaints that some GPs refuse to test people, and I don't think they're commissioned to do it per se, unless you're more likely for let them test you if you get family history of sickle cell. The GPs, we don't find out that if you get a family history of sickle cell and you tell them, say, look, I've got a cousin with sickle, then go send for test. And the test isn't that expensive. So some of it is lack of knowledge of within the condition be. When they're remote area, we don't know they see sickle cell, they know why I'm big. They think it costs a lot of money. But always either go to your GP if you want for me to test you before pregnancy, or go to one of the centers. Another thing I want to say with the NHS screening program, then they screen couples and then they screen newborn babies, but they actually screen children up to 12 months, up to a year. So if you've recently moved into England, or migrated or whatever, you can still be part of the NHS screening program up with a child up to a year. Yeah, so that's not something not many people seem aware about. Gene therapy It costs about 1.6 million. It's very expensive, but not. I think now dollars.
Yeah.
You may quote. It costs
Yeah.
about 1.6 million in this country. Then go do 50 people a year. I'm
Yeah.
not sure which one that they try to get from my colleagues, whether they don't do anybody we know. But somebody came from America who had it, and he ran the marathon, this year's marathon for the Sickle Cell Society. So
Right.
he was obviously cured, from
Yeah.
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 I left for now because when I get Boku, I go they listen from a distance. But
Thank you so
yeah,
much. We're
that's
grateful for that.
okay. That's okay.
Right. Okay. Tim. Mr. Ali and
I'll be the talk on mute. Sorry. One of the questions I'll be one let Auntie Abby touch on that, but don't go.
Yeah, you go come back. You go
Is
listen
that let's call them somebody say in younger boy that they suffer from sickle cell SS say, but interestingly, both parents not get the trait.
Well,
so it's curious.
You want me to go back because I think I've been to answer that.
Yeah, maybe the person joined a bit late. If you want to go back, or you can just answer.
I can go on that. There's no problem. I can try that. It's nice to let people and see what you talk about, because if you not get the trait, how is it possible to let you pass them down the line? That's the question. You see, so that's it. So as I say now, several types of sickle cell day, different types of them, including, but not necessarily limited to, the sickle cell HB, as it were. So the S, they all get. Okay? If you watch this, you will see. So each one gets this S. You will see this. SS, SC, S and beta plus, SD, SE, SO, and then SB0. They're all. None no day where if you not get the S gene, you go tell me say you get offspring way na sickle cell. It's just not plausible. Now I'll go into the details of what happened, what not happen, and I know how to begin cause uproar. But as you can see, for example, you say nobody no get them, and there wire, as you can see, and you can't get anything. You see, but definitely one must get them, two must get them, and when the two get them, if not just the carrier status, then get, you will see one full blown with 25%, 50% for the carrier status, and now any belle, not to just 10 picking or 10 belle, no. It's any pregnancy, you get a 50% chance of being a carrier, you get 25% chance of being a full-blown sickler, and then 25% of being unaffected. But you can't expect to get this gene from anywhere where it's not faulty. So there's something not quite right. I don't know if I answered the question.
Yes, you are.
So there's no way you could inherit this gene, when a sick gene, if you know they higher up in the tree. Is that okay?
He say yes. He say instead of being pregnant, we find out say get the trait. He say, but none of his parents them have them. What's the scientific explanation for that?
I can't explain that. As far as I know, there's something not quite right. There's no way. I keep saying, because na gene, na genetic sick, it has to come from mama or papa. Now you can be adopted. Yeah? Because something you don't know. But there's no way for let you inherit a gene where non-existent from the person where you mama biologically or your papa biologically. Is that okay?
Yes, thank you very much, sir. If the person get any further question, I'm sure you can type them back in.
Oh yeah, I mean.
Right. It's impossible for a child to be born with sickle cell if both parents are not traits. That's another feedback from Auntie Amide.
Exactly.
Cell does not skip a generation. It comes directly from parents, not grandparents, you know.
Exactly.
So that's fine. Okay. So then they back up as well with you, they say. I get 3 and them up because of the time constraint. I will take them 3, yeah, then we'll go finish for today. Do you have a family? I'll therefore apologize on that. Ali, I'll come to Ali first, then until I feed in Dr. Veronica. Ali, please.
And thank you very much, the whole team, especially Dr. Kamara, for this wonderful presentation. And this is a very important subject matter for we. So I've been trying to hang on every word where Dr. Kamara say. But the 3 different treatments where Dr. Kamara talked about, gene addition therapy, the pipeline, and gene editing. I do wonder if somebody went on to bone marrow transplant already, if from Dr. Kamara in vast knowledge and medical experience, if it possible for let somebody qualify for any of the other treatments.
That's a very interesting question. Now, I can say it's not limited to waiting the person able to afford. Obviously, the only way you will limit that if there's the complications then far outweigh the benefits. All right. Bear in mind, as I say, if at all the person don't get bone marrow transplant and he fail, walk, I don't think say he actually rule out the possibility of another one being successful. I don't know if you get me. See what I mean? So I think it all depends on the conversation we then go get with not only the patient and the relatives, but also with the specialist, with a hematologist. This is not a question for me for answer. I can tell you about the complications when they come to me in A&E, waiting for doing. But when it comes to transplant and maybe the complications and maybe the possibility of success, if one doesn't work and the other one, the possibility of working or maybe succeeding, I know going for tell you that because not to me specialty. But I'm sure with those questions, the specialist with a hematologist would definitely be a better person, better placed, and more versed for actually give you the appropriate answer. But just thinking about it logically, I don't think, say, if one fail, the other one not for work. Not unless, if you try the other one, it puts you in more of a risk of developing complications than the initial one will not work anyway. I don't know if that's helpful.
Yeah, thank you very much. Regarding the person, maybe they ask about the parents and all get and then the picking and they get there's another contribution from Dr. Hansil Samu. They say there might be maybe they may make mistake with them being test the parents. Then maybe it might be a case of maybe for them go for another test if they're still there around. For them go for another test because
you see now make I say I not be one for go begin insult person and things like that. But I don't see family waste scatter because of the fact that the Ngiam, the green light, say the certificate of the Ngiam is that he not get even one bandage in them. It means na AA. All right? The would-be wife, himself clear. But then born the first speaking now, nine that full-blown and sickler. Now that didn't go down well. Obviously, then scatter because and then he find out say they may falsify the test at the time. Whether I pay for that, or whether I do that or not, or whether I just lack of competence, or we can always have that human error. Then he send somebody in blood, then he go to the place where they mix them up and give you another person result. That may well be a possibility. So repeating it is not a bad thing. Nowadays we get what we call Martha's Law, where you can get a second opinion if that's what you want to do. And I'm in Africa anyway. You can go, you check this, especially when they get the sexually transmitted diseases when I tell you something will shock you. So man can go check other side. You know, that could happen. But as I say, logically speaking, biologically or, you know, medically speaking, it's just not possible for let somebody we not get them, the partner not get them, he actually give rise to picking them we get them. It's just not plausible. All right.
Thank you so much. I just read through waiting Auntie Amedy say about somebody with them we don't do two failed bone marrow transplant on. Unfortunately, once that don't happen, they prioritize that patient again.
Exactly.
Exactly. You know. Hopefully, exactly. Kind talk here and more advocacy and stuff will change than day.
Yeah.
Okay, so I'll go to Auntie Nafi. Auntie Nafi, if you're able to mute yourself.
Thank you. Now you hear me?
Yes.
Okay, I just don't put message in the chat, but that talk with Dr. Angela talk. Like same to me, say maybe let her repeat it, test result there. Well, I get a question, Dr. Kamara. We've been lost one of my niece, sadly, 2 years ago to sickle cell. She was 31 years old when he died of sickle cell. It's done 2 years now. But what I want to know, it be no better in sickle cell crisis. Be no better. I don't even think say they take regular medication anymore. They be not well completely. We know the better. All of a sudden, you just can't get, you know, crisis. Then you go admit, you get blood transfusion. He sadly die. So me, they wonder say, I mean, sickle cell na something when like a continuous. You go reach a time where the person go down like I don't better completely. You know, they take no medicine at all. I feel to say at some point I always get for the take regular medication, and that maybe you understand. I don't know if now wait I understand as we be, but we all been baffled. Why make it be done? They they take no medicine according to what we maybe understand. Then all of a sudden, after a couple of years, it just can't for down pancreasis and he sadly die. So I don't know if that can happen.
I mean, it's like groping in the dark. I don't know. The unfortunate thing here is they give me a scenario where the person not compliant with medication or maybe come off the medication, whether voluntarily on his own or the advice of a clinician. Yeah, I don't know.
Okay.
And then of course I don't know whether the complications will don't arise because the death, as it were. Because you know, if you get an underwhelmed immune system, clearly thing for be simple will become a burden for you. Yeah, so until you go cope with on a regular basis, definitely go now be protracted and then can cause complications for you. Yeah, so that's the thing. So if I can get a postmortem report, then of course I go chasing and so. You know, if I can go reticulocyte count, I can say so. Yeah, but I can't tell you just from the fact say 2 years you not take medication and then thereafter he then go into this crisis and from there on, I mean, he end up lost in life. Now it could be an underlying septic focus, or maybe he develops sepsis and then he get multi-organ failure and sadly, you know, he pass on. So the details where you give me, not that they're not right, it's just that they're not going to give me the support or the platform where I go team up and say that because you're not going to take the medication for 2 years, now I make this happen. Yeah, but as we see, people can get cured. You know, but even this Liphagia, where this bubble don't take, where you don't feel better, you know, they get any kind crisis again, then still they monitor them every 6 monthly, because the side effects or the complications of this Liphagia can be another form of cancer. So every 6 months, then they check them up for let them make sure say this is not the case. Yeah.
Thank you.
Thank you. Yes, Doc.
Dr. Veronica?
Dr. Gauja.
Okay, yes.
Thank you for joining us. Thank you so much.
Yes, sorry. Thank you very much, sir. Yes, sir. Thank you so much. I've not been start on time. I think a few minutes after 6. So I don't know sometimes the question where they ask you, we don't cover. I just want for Rob Motts for that issue the way they say impossible for let person get the trait when non-parent parents there. I be get that experience. I think the Papa can do test now one of the government labs. They been tell and say in genotype na AA, but it's so it end up for say the pikin now it turned out to be SS. It been out a whole row, but we insist say let it go other side and go do the test back and find out for say it get the trait. So yes, that is a possibility for say they not do the if we go the parents they forgo repeat the test at a reputable place. I don't get that experience in my practice. Secondly, I just want to ask with the if when I know the name of the test where then they do for the newborn screening, because I've been made to understand say the HB electrophoresis most likely you're not going for pick up the sickle gene the sickle the hemoglobin takes until after 12 to 18 months. So I don't know if now that HPLC or which particular test now they do now the UK for newborn screening where they able for pick up that test the gene. Okay, thank you very much, sir.
Thank you. Yeah. I mean, we get we own way name the way we deal with sickle cell as well, the newborn screening. I can actually send the link for let you see for yourself, which we do. It might not be the same as alone, and I don't like to compare, like for like or whatever, but I know say we definitely then they offer the antenatal and newborn screening program to anybody with suspected that the case. So then get them. Now whether the electrophoresis or not, I am not quite, or maybe limited to or restricted to that, I don't think so. But then get the one within the use. And mainly neither pediatrics or pediatricians with a specific interest in their hemoglobinopathies that they can deal with that. But the NHS definitely get a website where they say guidance on newborn screening. This now as early as July 2025. So it's pretty, very recent as you were, about a year ago when they do them, So I can send that, and then possibly then they go help you in terms of making it possibly a norm for the likes of Usai Unade and Salonde. But when they do it detect baby then way genetically the carriers of the hemoglobin variants as you are. Which makes them the offer because baby with the sickle cell disease vulnerable to life-threatening complications as you were. And when they identify them promptly after birth, then they will offer potentially life-saving prophylactic antibiotics and be referred for specialist care. And that I know what to do. They don't get any routine screening for babies at risk of inheriting thalassemia major. But most of the cases of thalassemia major then go for detection during newborn screening. But the carriers of thalassemia, they don't go for detector. So all baby them under 1 year, up to but not including the first birthday, they're eligible for the NHS screening. If the baby under 1 year no gets any documented proof of a result or a decline of the screening, then definitely then go offer screening, then go screen, i.e. then go offer the screening if the blood spot sample within they take can be taken before they reach the 1 year. But that's how is this. I can send the link and that could be helpful to you. Is that okay?
Yes, please. You say let's send on the link. The last question we did at the chat now. It says, is it possible for a parent we get SS for donate blood for transfusion for them picking?
SS for donate blood. Well, I'm not sure whether having SS go preclude you from giving blood. Might well be. I am not waiting the word for it. I'm sure about waiting the blood bank them or the one the way they look into this, the hematologist, then whether indeed being a sickle cell patient or full-blown sickler, whether that precludes you, whether that actually negates your ability for give blood. I mean, I know people who don't get cancer and other things, people who get hepatitis, this and that, blah, blah, blah. Obviously, I mean, we know about the fiasco of the blood and all that illnesses where don't happen, don't go on for so many years. But I'm not too sure whether sickle cell are one of them. Because waiting to sickle cell, obviously, now people will need blood on their own anyway, from time to time, if they need them, as it were, because they get destroyed quicker, and the replacement or the turnover is obviously more frequent than the person will not get the sickle cell trait or the disease, because now 120 days now it take for change itself. But the fact remains simple. I think forget the exact answer is probably a hematologist will go for answer that. But I would have thought if Natiwe they inherit, you probably yourself go need blood. So for let you able for be qualified for transfuse where clearly you can forget enough. But if then by doing so you expose yourself to more crises, logically I don't think they go allow you. Now whether the cells when they go inside your own body, because the person will donate the blood, the sickler, you go to you now we know to sickler, whether you go get them, I doubt very much, because inherent problem inside the blood cell itself. So if now damaged one they go in, probably will get an impact on the person where they receive them. But whether now complete and total contraindication for transfuse, I can't give that answer.
Okay. Yeah, Dr. Ansel himself don't confirm that patients with the disease generally cannot donate blood.
Exactly. Yeah.
Now, please not forget to send the link for Dr.
Yeah.
Gauja, please. Ifamulona, plenty, thank you. This session has been very, very interactive. Okay, is there a possibility for SS to cause further complications or damage to the hip joint and shoulder? Because 2 years back, when the crisis affected my younger brother, we thought it was his normal SS crisis, but later found out. Hold on, yeah. I'll just open this a little bit. Later found out, affected my younger brother. We thought it was his normal SS, but later found out his hip has damaged. And we had to take him to India for hip replacement and shoulder replacement too. It's in the chat. It said basically, is it possible for SS for cause further complications? We go cause damage to the person in hip and shoulder. So,
which I don't talk about is obviously you get what they call avascular necrosis, which means the blood supply to the bone is compromised. In one way or the other, it gets cut off. And so the bone, if you don't get the blood supply for going to them, the bone can die. Now they call aseptic necrosis. Yeah, it can happen to some injuries. For example, the wrist, we then call scaphoid. That both bone within at the wrist, where they just under the thumb, can actually get avascular necrosis. And then at the foot, Colles disease. And then at the hip, we then call Bεtεh's disease. But of course, if you get Bεtεh's disease, or maybe you get the avascular necrosis of the hip, where you don't know about, as a child, you just go about doing business, and then you get the pathological fracture. The fracture where obviously normally you're not going to expect to forget, then obviously if they're not managing properly, it can cause problems. And so if the blood supply get cut off, then something you can get for need something for replace that supply there, where normally in a hip replacement. But as a child, because then they grow, then get away, then the manager will then go put like a pin and for support the blood, at least manage until they grow. And then picking this and taking end up with early onset arthritis in the hip, and then requiring a total hip replacement or partial hip replacement as they grow older. Far younger than for B when they turn 65 or something, when they tend that way, then they expect for them.
Okay. The family on our plenty, thank you. This session has been interactive. fully packed, and I'm very, very grateful to Dr. Kamara. It's a very impactful session we don't do, but all good things must come to an end. I know say if we continue say for another hour or 2 hours, I believe say we'll be able to continue for that. But unfortunately, time not for permit we. So dear, if I'm at a big, we don't go over by 30 minutes already. I allow that because of how the session has been, but unfortunately, we get for try for come to an end. So I will ask the team for give your last word as quick as possible, so we will round up for today. I will go first with Dr. Angela, please.
Good afternoon, everyone.
Yes, ma'am.
Good afternoon. Dr. Kamara, thank you very, very much for that detailed and simplified presentation. Like we tell you now, the dry run for most of we was a refresher. And again, of course, we self learn some new thing. Thank you so, so much. My family and do on a spread the word. This presentation will be uploaded on YouTube. TM, I know say in the next couple of days, it will upload them. For the one that were not able to join, and I encourage them, make them join and let them learn more about the disease. The very first lady, I think that the second person we in comments where they talk about that myth about sickle cell, go die after 21. Of course, we all know say that not so true, but like you say, you don't know if people and still they go with that nas alone. But people with sickle cell disease, they die at any time. And we all say anything can happen, let alone. But my family don't wanna spread the word. And for that person, we say in parents, they not get then one of them gets the disease, then another one gets a carrier. Please, if the parents and they're alive, wanna go check. Because as soon as see, we not go lie now. We all they talk the same thing. Definitely somewhere, somebody gets the trait or the disease. But una thank you for una join, please, una spread the word. And una not forget, Bɔdi, a better past Gentri. Thank you. Over.
Dr. Samo. Dr. Ture?
Hello, Fambule Unadu and Dr. Kamara. Thank you so much for a well informative and session. I think everybody learned the interaction with all the questions being answered, nicely and adequately. I think bravo to you, Dr. Kamara, and all the people who will contribute as well. Without Una, the sessions not will be as it should be. So they ask that Una come give our contribution and also ask people around also for come and join. With this new breakthrough in the treatment, I think say of course the cost there with millions that are not so many people will afford them. However, for people every day in Europe or in the West, they can use this as an opportunity for go through whatever channels they can go through then doctors, and so that they will forget the treatment. Just like that Bobo on the video, where they suffer sickle cell throughout in life, able to forget the treatment and that change your whole life, And remember, say if you change the life of the person where they suffer the crisis, not so in one green life they change, like a whole family and a whole community. Because when one person get the disease, they get the crisis, now the whole family, they cause disruption in the whole dynamics of the family. So let's make this with this breakthrough treatment and all the rest, that we try to fulfill the channels that were necessary, so that the end they were able to forget and able to get her. And then they will get links back home, able for talk to governments and see where they were able for help, or any charitable organizations that they were able to help, so that people will get the required treatment. These sessions are always there. A fine for we self where they in the West Law, they listen to the session. They are long or say no more only when sick come. Now they go knock doctor door, but we try to prevent things before it happen, Well, Bɔdi always better pass, how many pounds or dollars you get, you see. So tell me, thank you for when join we. Or hope soon I will join we again, and I will play the sessions there on YouTube as always upload them by TJ. Thank you all.
Thank you very much, sir. Auntie Nafi?
Yes, TJ. No, thank you. I want to tell Dr. Kamara, thank you again, and tell everybody thank you for joining. I'm not going to say much because my colleagues and already say. The only thing I want to say is if you get possible in a sickle cell patient, whether or not you relative or a neighbor or extended family member, as it tell you say you get crisis, you make a reach na hospital quick, because when they're in crisis, it's very painful. Prompt treatment and they help them. So there, and I don't know what me they say. When I help for spread the message, when this link will share now the group, when I pass on to the family, then the party, then the neighbor, they will able to join in. Thank you, everybody.
Thank you so much. Auntie
Yes. Good evening, everybody, or good day, everybody. Thank you very much, Dr. Kamara. A very, very well educative presentation we did today, and we tell you thank you for that day. And just like what all man don't say, I know for say Africa na the difficulty day. Treatment don't day when a brand new treatment where it just come out, where we all know a very expensive at the moment, even at the West here. So let alone for Africa. But we know for say no more, just like we ate the camel that sick them, it be expensive, but eventually they're able for bring the price can down. So they hope say one day most of the treatments them go then Africa where all man go benefit from them. And I hope say all man go pass this information to other people them. Let themselves sort of get the information and understand which in a sickle cell and all the myths the way they don't talk now. So Dr. Kamara don't talk, where you don't bust them myths then they collect people then go understand and pass them on. So anybody where they try to talk anything, we all don't understand how you go pass on to other person. And well, Bεtεh pass Gentri, una thank you for una attend. Thank you.
Thank you very much. And the last but not the least, Isata. Okay.
I'm still here. Right. So I don't get much for add. My colleagues will say everything. This is a very good presentation, Dr. Kamara. Thank you very much. So I always, say if anybody they depend on myths about sickle cell, una start for turn to facts and look at clinical presentations and things like information like this. So for helping ourselves and our family members or friends. But the one thing we're very important is Bεtεh pass Gentri. So that's all I have to add tonight. Good night, everybody. Thank you very much.
Thank you so much. Dr. Kamara, my last word, please.
Yes, thank you. As I say, I'm so grateful to everybody who joined, the medics, the family members, and the organizational members, the Islamic group, of course, the Salon organization, the Fambulem, sisters, brothers, all over the world. I'm so grateful. Now, because of Una and I make this thing they exist, and because of Una and I make they carry on 6 years and counting. Now, I noticed one person asked a question. It's quite important. They say the parents, they refuse to get tested. I don't know if you say one by extended family, one pikin get full-blown sickle cell, and then the other one na carrier. But then the papa and mama refuse to get tested. What we go do for increase the testing back home, especially amongst the older generation? Now, I don't even know what to answer. As far as I know, raising the awareness, educating them as to the benefits rather than the risks would be a good thing. And of course, doing away with the myths and doing away with all the supposed, then they say, well, na witch, na fange, na eikolam, what's in the word they say? Ale, or whatever, when in actual fact, or na witch is the witch, or they afraid God, or they pray to God, na possibly they with the demons and things like that. Doesn't work like that. If you day in the gene, it can pop up at any time. Yeah. Obviously, if you marry the first cousins, well, so sick then they not necessarily sickle cell, but 6 and day where you can definitely even they are higher risk of inheriting or passing on from one generation to the other. But obviously, with the consistent, advocacy, consistent awareness, sensitization, education, I sure say people will change their mind. Not to for begin stigmatize them, not to for begin judge them. So we get for do away with less of the stigmatization and maybe get the government, if possible, for provide more, for dip more into the healthcare systems and make it equally available, create that equity. That way, I'm sure people will be, more interested for come forward because they know say nobody will begin judge them, nobody will be stigmatize them, because they get this thing and because they're important enough forward. So these are the things where I think say that the message that we each and every one can we supposed to carry forward yonder. I'm really grateful for our attendance, and as we see, we're not just restricted to sickle cell. We got a wide range. We team, a very rounded team. I'm so proud of my team, and I could not be prouder. So, una no say we want one thing. We want for go on air. We want for people and for Yeriwi. We want for more people and no say, if we talk, well, Bɔdi, all man know what that mean. And that's why we want, if una enjoy yourself today, una get the answers today, then clearly spread the word, spread the message. Let we get people in a salon window for get Zoom, make them able for join we. Do ya, if I'm with them. Would I get that idea there or would I get that possibility there? Please, please, please spread the word because we can do, we know say a healthy nation, not a wealthy nation. And well Bɔdi, he better pass Gentri. Thank you so much and God bless you all.
Yeah, if I'm plenty, thank you. I don't get anything much for say. They don't see all the thing. The links them, they don't be asked about links, they must and they do the test and la tongue and stuff. Thank you very much, Dr. Angela. And Dr. Veronica and Gauja, you don't put the place the way they do the test and day and the days them and stuff like that. So dear, people are way interested in that information. They look on the chat, try for copy that information. If you don't get them, maybe you don't go offline, you remember later, you want them, just ask any of we. I will make sure say because we can normally save them chat there. So if anything come up, if you need them, we'll come back and look for them. I know somebody will make a suggestion for a topic, and we'll go look into that and try for present them. But plenty, thank you. We will see you again the last Sunday of the month. This time by God power, we'll try for keep to that schedule day. We will make una know as soon as possible. It will be the next topic and we'll go for present. But we'll meet again. Well, Bɔdi, Bεtεh, Gentri. Good night.